My name is Dr. Geoffrey Mutuma. I work in Kemri as a research scientist in cancer in Center for Clinical Research in Pathology and Oncology Research Unit. Cancer of the skin and cancer of melanoma, they are normally discussed in the month of May. Mainly, cancer of the skin is not very common in Kenya. The commonest cancer of skin in Kenya and more so in Africa is melanoma. Melanoma is mainly the cancer of the skin, mainly the skin which is not pigmented, mainly in the palms and also in the feet. Most melanomas, they occur in women, and they are mainly a dark spot in the foot. And normally, as usual, is that cancer is not painful. So you find that somebody has got swelling in the foot which is darkish, and since it's not painful, people don't take notice of it, or they don't care very much about it. But cancer of the skin, cancer of melanoma, is very aggressive tumor. Most people, by the time they come to see the doctor, the cancer of the skin, that's melanoma in the foot, it has already moved from the skin, it has moved all over the body. It normally starts like a very small swelling. It becomes an ulcer which does not heal and is not painful. By the time you notice it, it's already moved to the lymph node, with what we call metastasis. Cancer of the skin, melanoma, is not easy to treat. The first treatment is surgery. You remove the big part of the tumor of the melanoma, and then you can give chemotherapy or radiotherapy, especially when it has moved or when it has metastasized from the skin, from the foot. It goes to the lymph node and goes to the lung, and it can also even go to the brain. So cancer of the skin is a serious cancer here in Kenya, not very common, not among the 10 common cancers in our cancer registry in Kemri, but it's a common tumor which affects mainly Africans. Melanoma in Kenya, it has no regions. It affects people sporadically. It can affect anybody at any time and from anywhere. And because it's a rare cancer, we don't have real statistics of locations and where it's common and where it's not common. What we know that it affects the feet, it affects women, and we don't know where it's very common in Kenya. It's normally actually common anywhere in Kenya. There's no one particular area where I find that the melanoma is common. We don't have a reason why it affects women more, although men are not affected also, but we don't have any reason why it affects women more. But most cancers, in fact, there's got predilection. They like one gender than the other one. We don't know why. And that's why we find that cancer like melanoma, it tends to be a bit more common in women than in men. Melanoma is not among the 10 common cancers in Kenya, so rarely do we do any research on melanoma because it's not very common, and nothing much we have done as far as research here in Kemri about melanoma, but it's something we need to look at. And the most important thing is that we look at our data and see how common the melanoma is and how many people are affected per year and per month, so that we can be able to actually do research, because there's no need of doing research on cancer which is very rare when we've got very common cancers where we have not even done research on. So melanoma is not in our top list of doing cancer in of doing research in. Mainly, there's no way you can prevent having melanoma, because it's a cancer which starts by itself. Most people, they say that they have been pricked by a thorn, or pricked by a nail, or pricked by something in their foot, but really it is not actually the risk factor. So we don't have any risk factor of developing of cancer of the foot, that's melanoma, and it's not actually related to radiation, because most of other skin cancers, they are related to skin radiation or to sunburns, and melanoma is down there in the foot, so it has no any risk factors. It is good for people to look at their feet and also at their palms, but mainly melanoma is from the melanin, because it affects the areas where there's no melanin. That's why it's called melanoma, and that's why it is mainly on the foot or in Africans, and mainly on the palms, but mainly most of the melanoma appear in the foot. It's important to look at your foot. Is there swelling which is blackish? Because melanoma is a swelling which is blackish. It's good to look at your foot to make sure that at least there is no swelling or there is no discoloration on your foot. It can also develop in, especially on brown people, in brown Africans who are a bit brown. The Africans who are very dark, those are safer. The Africans who are also brown, it's good to check if you got any swelling which is darkish on your skin, especially on the legs, which are exposed to the sun, to check if there's any swelling which is black. And this black is good to make sure it's removed. What is very important is that the melanoma, when it starts, is just to grow, and it becomes big and big. It's the most important thing. If you've got any abnormal pigmentation of the skin anywhere, it's good to check. And the thing to check is it becoming bigger and bigger? Because remember, it's common in the foot, but can develop almost everywhere. So it's good to check. Do you have areas which have different color from your normal skin?